Hi, I'm Hannah, a caregiver at the senior residency. I have a concern about one of our residents, Mr. Ethan.
Sure thing. I'm Luna, the pharmacist here. Please have a seat in our consulting area.
Thanks, I appreciate it.
So, Hannah, thank you for bringing this to our attention. Can you tell me more about Mr. Ethan?
Yes, Brian Ethan is 57 years old. He was diagnosed with pernicious anemia, and the doctor prescribed him B12 injections. The problem is he really dislikes needles and is quite afraid of contamination. Is there a possibility we could switch him to oral B12 instead?
I see. Does he have any other medical conditions we should be aware of?
Yes, he's also hypertensive and is currently taking amlodipine 5 millimoles.
Is his blood pressure well controlled?
Yes, it is.
Any other medical issues?
Nope, that's it.
How about his medication? Is he taking anything else besides amlodipine?
No, just that.
What about over-the-counter medications?
He sometimes takes Tylenol.
Got it. Is he allergic to any medications?
Yes, he is allergic to penicillin.
How severe is that allergy?
It causes anaphylaxis.
Understood. Does he smoke?
No, he doesn't.
How about alcohol?
He drinks about 2 cups of beer after dinner.
Okay, and what about caffeine?
No caffeine.
Can you tell me about his diet?
It's pretty normal.
Would you mind giving me a couple of minutes to check my references?
Sure, take your time.
All right, so pernicious anemia is a malabsorption condition due to a lack of intrinsic factor, which is essential for absorbing dietary vitamin B12 in the small intestine. Typically, vitamin B12 needs to be administered parenterally because deficiencies are often due to malabsorption. We usually continue parenteral B12 until all neurological symptoms and hematologic abnormalities are resolved, and then switch to oral maintenance therapy in a way that works best for the patient. If we decide to go with oral B12, we should follow up to monitor hemoglobin levels and ensure he's adhering to the treatment.
That makes sense.
As for his fear of needles and contamination, you could consider using a smaller diameter and shorter needle. It might help to reassure him that you're following safe injection practices. There are also strategies to reduce pain, like teaching him relaxation techniques, such as deep breathing or distraction methods, like counting while the injection is given.
Those sound like great suggestions.
I just wanted to remind you to keep an eye out for any side effects he might experience with the new medication.
Absolutely, Luna. I'll be sure to watch for anything unusual. I just want to make sure he's comfortable and feels okay.
And I really suggest we take a closer look at reducing his alcohol consumption. It might make a big difference for him. Also, I think following up with a dietitian could really benefit him. They can help create a plan that supports both his health and his goals.
Right? That way, he can have a comprehensive approach, reducing alcohol while also focusing on nutrition.
Do you have any other questions for me?
No, that covers everything. Thanks for your help.
Of course. Can we arrange to call Mr. Ethan in 2 to 3 days to check on how he's doing with the medication?
Absolutely, that sounds good. Thanks for including me in his care.